In a treatment like transplant, and to take your later question first, what is the role of MPN in transplant? We always used to worry that transplant does give rise to treatment-related mortality and morbidity in terms of chronic graft-versus-host disease. With our current studies, we see mortality of 10% or so. And your severe, moderate to severe chronic GVHD rate of also around 10% or so. So naturally, these numbers are much lower compared to, say, historic numbers of 30% or so for non-relapse mortality. With those numbers, then you feel more comfortable taking patients to transplant early on in the disease. Now, the treatment like transplant is always going to be better if it is done early in the disease. So that's one area that is changing, because there's enough data that we showed and others have shown that advanced disease does poorly with any treatment, including transplant. So I think that comfort level has increased. Number two, we are now treating more and more older patients. So we just transplanted a 76-year-old with our myeloproliferative regimen, so older patients. So that is the second thing that is changing. In the discussion, there was some discussion about the relapse associated with ASXL mutation. Now, with our relapse rate being so low, we are not finding that in our studies. So that was an interesting takeaway. And I think more and more transplant is becoming more sought after treatment because that, at the end of the day, is the only curative treatment.